One of the more frequent complaints I hear from patients after surgery is that they feel as if they have a tight band around their knee. Hello and welcome back to the channel. I'm Adam Rosen, and in today's video I'm going to talk to you about something that's super common. A lot of patients complain of this feeling as if they have a tight band around their knee after knee replacement surgery. So when I break this down, I want to really talk about sort of three different reasons why you might feel that pain. Studies that we kind of do, but there's not great studies to really answer the question, and what things to really look out for. What things can you do to actually make your knee feel better? And as always, if you haven't already subscribed, please do so. It really does help the channel, and give it a thumbs up if you enjoy this content. So jumping right into it, when people have a knee replacement, usually it's because they already have arthritis. And sometimes it can be what we call post-traumatic arthritis. So you may have had other surgeries for either a fracture, maybe an ACL reconstruction, and you have hardware in your knee. So someone has already opened up the knee and has closed the knee up. That has led to pre-existing scar tissue. Or also the lining of your knee, called the synovium, when you have arthritis, is thickened so that tissue is just tight. The analogy that I like to use is like if you got a paper cut on your knuckle, you know that the knuckle is okay, but you can't bend that finger as much as the other one because the tissue is inflamed. And that lining of the knee, which in a normal knee is like a rain jacket, super thin, in an arthritic knee gets thickened. And that gives this puffy appearance to the knee. A lot of people describe swelling, but it's not truly fluid. It's actually a thickening of that lining around the knee. And some people, due to their arthritis, have decreased range of motion. We call it pre-existing stiffness. So one of the best predictors of how much motion somebody would get after a knee replacement is how much motion they have before knee replacement. So if you have scar tissue, if you've had prior surgery, if you have stiffness, those are people that are still going to have stiffness in those soft tissue structures that we can't replace at the time of knee replacement surgery. Now, the other things are things that are more specific to what can happen after knee replacement surgery. So one of the dreaded complications that we see, it's a biological thing, is this thing called arthrofibrosis. Now, some people can feel stiff but have good range of motion, or have a little bit of stiffness. Arthrofibrosis patients have severe stiffness, very, very limited range of motion. They put down an abundant amount of scar tissue all around the knee, and it really limits the motion. And it's really hard for us to do anything to improve the motion in those patients. The other thing that can happen, rare, is what's called HO, or heterotopic ossification. We see this more frequently after hip replacements, but occasionally people will actually have bone form in the soft tissue in and around the knee, and that can also limit motion and give you that tight feeling of a band around your knee. Now, the other kind of two things are normal can be worse in some people, but can be manageable with a number of things. So that's inflammation and swelling. So if you have a lot of swelling, it's going to give you that tight feeling. If you have a lot of inflammation, it's like that paper cut on your knuckle, the knee is going to feel tighter than normal. And hopefully, with some remedies that I'll talk about at the end, we can improve those things. Now, the last things I want to talk about are specifically related to the implant. I did this ChatGPT question of just like, hey, why do I have a tight band around my knee? And it kind of went through these things: soft tissue swelling, scar tissue, which is the arthrofibrosis I talked about, muscle tension, and the feeling of an implant. Now, sometimes the feeling of an implant is going to be normal, and it's hard to really explain to people what that's going to feel like because every patient is different. But if the kneecap is resurfaced and by accident, the surgeon makes that thickness of your replaced kneecap thicker than what your kneecap was before you had it replaced, that tightens up the tension on the muscles and in the kneecap joint. It's going to give you a tight band, especially as you bend the knee. The other things that we run into are where the knee itself is straightened. So if you were really, really knock-kneed and then we straighten it out, the tissue on this side of your knee is tight, and then as we do this, it gets pulled and it gets tighter, so it can give you that tight feeling. But it's because scar tissue or normal tissue that was tight is now being stretched. That usually relieves itself over time. And the last thing specifically related to the implant is an oversized implant. So if somebody puts an implant in that's either too wide or off center, or even on the thigh bone, again, remember we cap the thigh bone with a piece of metal. If that piece is bigger than what your knee was before a knee replacement, it wasn't resurfaced anatomically, that can give you that feeling of this tight band sensation inside the knee. Now, how do we work this up? Well, one of the most important things is just to examine the knee. We want to feel for swelling. We want to examine for inflammation. We want to test the stability of the ligaments. We want to test the range of motion of the knee. So these are all things that we can do. And in a knee that doesn't have swelling and has normal range of motion, usually in those people, that sensation will subside over time. But if somebody has severe stiffness, there might be interventions that we might do early on. The other thing which can be really helpful is an x-ray. So looking at x-rays in 3 planes allows us to assess and measure the implant thickness and size compared to your knee replacement before the knee was actually replaced, and making sure that the implants are well positioned and not overhanging over the bone. The other studies, which are rarely used because they rarely offer information, so things like ultrasound, which can look at soft tissue and they can even measure soft tissue, but if we don't have an ultrasound of what your tissue thickness was before surgery, you can't really make an assessment as to is the tissue thicker than it was before surgery, and is that tissue thickness due to inflammation or swelling or scar tissue. It's kind of hard to piece that out. So there's not much that we can do with that information. And the other question that people always have is, won't an MRI help me? And MRIs are rarely helpful because most frequently when we do an MRI, even with metal suppression techniques of a knee replacement, the radiologist report reads something like, limited evaluation due to metallic artifacts. So the metal puts out all this sort of artifact in different planes, and we can't really see or assess the soft tissue quite well. So that being said, most important thing is, okay, what do you do about it? Well, the first thing is, especially in patients that have this feeling early on in the first few months, is cautious observation. Most people, as the inflammation subsides, will just get better on their own. So that's number one. Two, it is really important to control inflammation and swelling. So there's a number of remedies, things like elevation and compression, simple modalities. Icing, diligent icing, especially these cryocompression icing machines that offer both cold therapy and compression therapy, can be really helpful. Anti-inflammatories, whether or not these are over-the-counter anti-inflammatories, your surgeon might prescribe prescription anti-inflammatories or even put you on a period of steroids to reduce the inflammation. Those are really, really important. So if we can reduce the inflammation and reduce the swelling, that feeling of that tight band goes away. The other important thing too is scar mobilization. So it is important to prevent scar tissue from building up in the first place. Now, this can be caused by bleeding in the joint, especially if you're on a blood thinner. That blood can then lead to scar tissue, but we have different spaces in the knee. And usually when the knee is straight, the space is open, and as you bend the knee, those spaces get compressed down. So if you don't bend your knee well, if it hurts and you're afraid to bend it, or you think you're going to bend it more later, just realize that blood is filling up that space, and that blood turns into pudding and then turns into a leather rope. So then in 8 weeks or 12 weeks, if you try to bend it, you're fighting against this resistance, and it's pretty much impossible for us to get rid of that. So you really want to work on early range of motion to prevent that tissue from being formed in the first place. But if it starts to form, you can do scar mobilization. So you may have watched some of my other videos, like one of the beginning ones, the best range of motion. There's the chair exercise that I discussed with all of my patients, and the idea of short times, many times. This chair exercise for 1 minute every hour on the hour while you're awake helps stretch out the quad, helps stretch out the muscles and the tendons, helps mobilize the knee joint, kind of presses that scar tissue out of there. That helps. The other thing, in some people, if they get arthrofibrosis, they start to get adherence of the kneecap in the side portions called the gutter. So with your knee straight, you can slide your kneecap back and forth and up and down. Your therapist might show you this, and that is a scar mobilization technique that prevents that tight band feeling around the knee. The most important thing is gentle range of motion. So if you have the option of doing exercises for an hour a day and then sitting in your recliner, you're probably doing more harm than good. Whereas if you can do range of motion exercises in a glider or a rocking chair or in a pedal machine or on a bike or on an elliptical, lots of options, that gentle range of motion throughout the day keeps the knee loose and prevents some of that scar tissue from forming and adhering in the first place. And the last thing, which is a little bit more complicated, I see a lot of second opinions. 90% of the time, the surgical technique was done well. And usually the reason for second opinion and pain and problems is other stuff. But occasionally implants are put in not the greatest of positions. So if the implant is overhanging, and we have studies that show this, that people will have pain if there's more than around 2 millimeters of overhang. So if the implant is overhanging over the bone, or too big or too wide, or the patella is too thick, sometimes if everything else fails, a revision surgery is needed to actually go in there and replace the component that was not put in correctly in the first place. So a lot of information that hopefully answers some of the questions that you might be feeling about why you feel that tight band sensation around your knee, and some remedies and modalities that might actually help you if you're in the majority of people where, with time and swelling and elevation and compression and that type of treatment, will get these symptoms to subside quickly. And if you know someone that would enjoy this content, share this video with them, because lots of people that I see have the same complaint. You are not alone. And as always, until next time, I'm Adam Rosen. Thanks for watching. Stay safe.